All right. So our next topic is something that does not get talked much about, which is emotional storm that follows childbirth. Behind every new mother's smile, there can sometimes be anxiety, panic, even trauma, and yet postpartum mental health remains one of the most under-addressed areas in India. Joining us are some of the most respected voices in the field. Next, we are honored to welcome a true pioneer in Indian psychiatry, Dr. Kersi Chavda. He is a veteran clinician and past president of the Bombay Psychiatric Society. Dr. Chavda currently consults at PD Hinduja National, Hinduja Healthcare, and Sir H.N. Reliance Foundation hospitals. He has been instrumental in shaping mental health policy in India, from chairing the IPS Task Force on School Psychiatry and Counseling to contributing to landmark Supreme Court judgment decriminalizing Section 377. Dr. Chavda's work spans child and adolescent mental health, ethical guidelines in therapy, autism spectrum disorder management, and advocacy for learning disabilities in schools. A TEDx speaker and author of multiple academic chapters, his insights are both deep and transformative. So, join me in welcoming Dr. Kersi Chavda.
Thank you, thank you.
Next, we have somebody that you will remember because you saw her just in the morning, Miss Sophia Peermohideen. With 23 years of experience in clinical psychology, Sophia is the founder and director of Mind Wellness Center Wadala, offering care across the lifespan from children to older adults. Please give it up for her once again. Next, we have Yellapragada, the visionary founder of Marbles Health. Ramya is revolutionizing mental health care in India, making neuromodulation a standard pillar of treatment alongside medication. She built EASE, India's first medically licensed portable neuromodulation system, delivering safer, clinical proven and effective outcomes for depression, anxiety, OCD, addiction and cognitive disorders. Her flagship program, Ease for Mothers, tackles postpartum and perinatal mental health with neuromodulation plus extended therapeutic support, creating life-changing impact for mothers and families. Through Marbles Health, Ramya is making advanced brain healthcare scalable and accessible to millions. Let's give her a huge round of applause. Another familiar face in this panel for the moderation, Ruchika Jain.
All right, thank you so much for having such a wonderful panel and the discussion. I know how important this discussion is, not just for mothers at this point, but their husbands and families. So to begin with you, doctor, could you tell us how okay, I lost the track of my questions. Okay, could you tell us how common are postpartum mood disorders in India, and why does it still remain underdiagnosed and misunderstood?
I'm not sure what the exact percentage is because it's probably extremely under-reported and underdiagnosed. But we talk first of postpartum blues. That's probably 20% of the population. Everybody has postpartum blues, even more than 20% possibly, where you just land up, after a baby is born, you land up feeling sad and down and tired and exhausted, and you wonder whether it was all worth it, and then you become okay in about a week or 10 days. Then you have postpartum depression. Unfortunately, we are seeing an increasing amount of this. And even more unfortunately, it's still extremely underdiagnosed because the typical Indian woman is supposed to not have this problem. Yeah? How on earth can you be depressed that you've had a baby, especially if he's a boy? How on earth can you? And if you have twins, even better. But it exists. It exists tremendously, and we are seeing more and more of it in our clinical settings. Fortunately, at least in the urban setup, people are talking about it. But the stuff that happens in our villages is absolutely ghastly. I've lost count of the number of times when a woman has been branded by a red instrument, hot instrument, in order to get the witch out of her, or things like that. And these places have been just like about 10 kilometers away from civilization, a good city. And then we have the final, very frightening postpartum psychosis. That's probably 1 in 1,000 or something, but it exists. And this is something which needs immediate, everything needs care, but this needs to be looked at with great care, because technically you're allowing something to be at risk. You're allowing the baby to be at risk, you're allowing the mother to be at risk. We see very few, fortunately we don't see as many as we do in terms of the postpartum depression, but it exists, it's very frightening, and as is the case in every person who comes to us in our profession, ours is the only profession where the person says there's nothing wrong with me, there's something wrong with you. If I go to a cardiologist, I'd go hoping and begging that the person will find something wrong with my heart because of which I'm getting a chest in the pain. I'm getting a pain in the chest. Good Lord, I must join the MDA. Well, that's okay. I was in the first governmental panel for getting concessions for learning disabilities in Maharashtra, so I can say that. Yay! Yeah. Narcissistic man sitting on the stage. Okay, come back to a little more serious stuff. We are looking at people who are having major problems. I think in my fairly checkered career of about 40 years, I must have had about 8 or 10 postpartum psychosis who have been brought to me. All have done well with medication. Some have needed more than medication. We'll talk about that later. But it exists, it's very much there. Today, of course, because we believe in the equality of the sexes, we talk about postpartum depression in the man. And why not? It really exists. The number of men who land up feeling down and scared, because of course it's a big responsibility. It's not that after 6 months you're going to say, oh, let's give him back. So that kind of thing exists. It's a major problem. It is not something to be sneezed at. And I'm so glad that we are talking about it.
Hello, yeah, thank you. So let's understand the foundation of PPD first. So is it purely hormonal, or do psychological, social, medical, and birth-related factors also contribute to it?
You're after me again?
You and Sophia ma'am, both.
Could you repeat the question?
Yes. So the question is that is PPD only hormonal, or does psychological, social, medical, and birth-related factors also play a role?
Psychiatrically, this is called attention deficit disorder.
Yeah. I was more focused on him answering.
I know, everybody focuses on me. What to do.
Because it was a continuation. Hello. Okay, so we have to consider a lot of aspects when it comes to PPD. See the risk factors that would be involved. So the physical factors, look at fatigue and pain. When a person is in acute pain, obviously the chances of depression are higher. Sleep, if they have not slept. So sleep is a symptom and a cause, both. So we have to see if the person has been, sleep 25 minutes if the person takes before they can fall asleep while the baby is sleeping, then that means that's mostly depression. And if they have intermittent or fragmented sleep at night, meaning it could be depression. So if the mother is able to sleep along with the child, then it's mostly fatigue. So these are aspects you look into. The other aspect could be, say, hormones. So in general, we have the inflammatory hormones which promote or cause depression. Plus, at the same time, we have the CRH being produced by placenta, and as well as the cortisol being produced. So there is dual way stress is produced in the person after childbirth. Thirdly, we will see the social factors. The social factors would include the family support, husband support. People, girls, women who have husband support are said to be doing much better than those who don't have. And those who have family support are obviously, family and social support do a lot better in that sense. Other than that, we also see personal attributes. To what extent I feel I am good to deal with the situation, so my personal attributes, how is my self-esteem, and how well I think I can cope with it. Oftentimes, women tend to silence themselves and not speak about the problem because they think they will not be understood. So it's very important for women to be able to express themselves. That one thing that as psychologists and as family members we have to do is to just hear them. All that you need to do is to hear and not dismiss, saying, oh, go do yoga, go do this, go do that. That's not going to be helpful. Other than that, you have the child's temperament. If the child is generally irritable, restless child, having stomach-related colic issues, or if the child is born with preterm, generally low birth weight child, or with a disability. So these are things which will promote depression in a woman. So I covered the psychosocial, physical, fatigue, tiredness. So I think I covered most of these. This is largely what will cause depression in a woman. Also, if there are pre-existing factors, say if there has been previous loss or trauma or any psychiatric condition which was pre-existing. It is very well known that women who are generally showing depression postpartum may have had the onset during pregnancy. So that is an important aspect to look into. If there has been a general anxiety predisposition. So if somebody already is a very anxious child, then they are more likely to develop depression. There are adequate scales that we have. What we as individuals suggest is that, or as community workers, is to do minor screening. So we have some scales like Edinburgh, postnatal depression inventory. So you have it for the individual, the woman who's pregnant, and also for the partner. So like Dr. Kersi very well pointed out that there are men who are also going through depression. So like I had one last night, and his child is now 4 months, but when he earlier came to me, he said, his wife was going through that phase of childbirth and all the attention was on her and the child, and he was feeling completely left out. So the risk factors for women are almost same as for men, except that for men it's the employment and the financial aspect which play more role. And he was, at the state in his job where he was finding it extremely difficult, like maybe in transition times. So when he came to me, he actually said, I am not feeling at home because there are so many people at my place that I don't have anywhere else to go. I very kindly offered, I said, so my third consulting room is open. If you ever wish to come, you can sit there. I will not come there. And he said, that's very kind of you, but I will not take your space because that's your professional space. I said, well, I rarely allow, but I'll charge you sometimes, So we just laughed it out. But yes, the idea here is that they feel very left out at the time because the attention is not on them. Or they're not even getting the desired care and attention at that point in time. There are some more screening tests so PHQ is a very commonly used screening test. There are others, for anxiety that you can use. And I think that's a good enough answer for that.
Yes.
Hi. So since I work a lot with the brain, there is something that I would like to add here. A lot of mothers that we work with feel that, they are different, that they're experiencing postpartum depression, postpartum anxiety. So just to normalize what's happening with the mother. So when a mother is pregnant and post-birth, there are physical changes that are taking place in her body at the hormonal level and at the brain network level too. So there is documented research and evidence of physical changes in the brain, like the hippocampal volume reduces, the insula becomes heightened, the amygdala becomes heightened, the default mode network, which is mostly the network in the brain that is responsible for self and how the self identifies with the surrounding, the social surrounding, that is dampened. The self and social cue network is dampened, and the emotional areas of the brain, like the amygdala, the insula, that is heightened. And why this happens evolutionarily is that essentially evolutionarily it is the baby is more prioritized because it's the next generation. So the mother's emotional reactivity is heightened. Threat perception is heightened. If the baby is hungry, like the mother should understand the baby is hungry, should that emotional bond with the baby has to form. So her emotional sensitivity is also heightened. Now in this case, I think all of us have heard about mom brains. You know, there's a lot of forgetfulness. Sometimes math does not math, like, you know, sometimes basic math eludes them. That's because there is a actual physical change in the brain. And sometimes, and why does PPD or anxiety not happen to every mother? Because if the resilience is greater than the stress that the mother is going through, in terms of, let's say genetically the mother is more predisposed towards anxiety, or maybe the culture or the family or the husband is not as supportive, and you know they have this already there, then they're more prone to something like this. Like if the resilience is higher than the changes that are happening in the mother and the body, then this will not manifest in the mother. So that's why sometimes even with the same mother in one pregnancy, you might not have experienced such kind of shifts. Maybe in the second pregnancy, circumstances change and you experience this. For example, very recently, Jennifer, I think Lawrence, I'm not sure, she had 2 babies, and she recently spoke in a very famous interview saying that the first time that she had her child, she was very it was a very good pregnancy and postpartum. But after the second baby, there was something that was different, where she had to go through depression, a severe bout of depression. And she took a certain medication that helped her specifically. And she also talked about the medication. But yes, so essentially it's very normal. It's just that what is your body more predisposed to at that instance, and if you are more resilient to those changes, then you can sail through it. But the thing is that if you're going through something, then understand that, you know, there are multiple factors. There's physical changes, there's hormonal changes, there is social cues that are impacting it, and that you can actually do something about it in the moment. And these physical changes have been shown to at least last 2 years post-birth. And sometimes, you know, if adequate intervention, like generally, gradually it resolves over time. But, you know, generally during that time is when you're bonding with your baby, etc. So if you're constantly sleep deprived, stressed, you're not getting that emotional support and connection, it might have consequences, you know, with emotional bonds with the baby, or, you know, the family relationships, etc. So it's better to address it as and when you require it. And if you need that extra support of, you know, some medical help, then don't hesitate to take it. You know, you can use, you know, some safe medication for pregnancy, for breastfeeding, or you can also do, you know, neuromodulation, brain stimulation, which is not invasive in nature. Therapy is great. Some of the mothers that we've worked with were hesitant to dig up old stuff. They were like, "Mujhe abhi ke liye kuch do." So there are different kinds of people, and it is important to have different solutions for different kinds of people and not judge. So that's what, you know, I just wanted to normalize it and say that, you know, circumstances can change.
Thank you. I think it's very interesting to know how it's just not 9 months of pregnancy, but a lot before and a lot after.
Yeah, so let me also add a little bit more than what these 2 ladies have said. In today's generation, there's a lot of stuff happening with IVF. There's a lot of stuff happening with assisted methods of reproduction. And when you're going through that process, which at times can be fairly impersonal, find out when your ovulation is, have sex at that time, the man has to sometimes masturbate into a test tube. It's extremely personal and frankly dehumanizing. And it's extremely unlikely that the first time is going to be the successful time. So some ladies go through 6 cycles, 8 cycles, 10 cycles because they're so desperate to have their own child, and then they do succeed. Most of the time when these procedures are going on, there's also some amount of hormonal stuff that the gynec gives. And that is going to affect the lady, that is going to make her emotionally labile, and that does later on aggravate her mood after she delivers. Point number 2, given that depression is affecting about 20% of the population at any given time, it would be nice for us to believe that a huge number of people, including ladies, are taking treatment for it, whether it's therapy or whether it's medication. All the latest research points to the fact that if you have been on medication and you get pregnant, you're supposed to continue with the medication except for a few tablets, few kinds of medication which are considered to be avoidable. So the bottom line over and over and over again that we keep talking about is do not stop medication. There are lots and lots of papers which now point to the fact that if the child is born of a mother who has been on medication through all the 9 months and before, the chances of that child being a happy child, good child, developing well child, and the mother not having a breakdown is higher than if you stop that one stupid tablet, because what the heck, how can mommy have a tablet when she's pregnant or lactating? So the latest research points to the fact that do not stop except in certain situations. Point number 3, we have to, like they both said, normalize depression. We have to normalize postpartum depression. We have to normalize anxiety, psychosis, etc., etc. One of the most important aspects of any kind of psychiatric issue today points to the fact that there's usually some kind of genetic component. Almost always there will be a genetic component. And if you take a very detailed history, you'll find that somewhere in the family tree, there was depression or psychosis or anxiety, and it was probably untreated because 70 years ago, 80 years ago, nobody ever talked of mental health. And because it was untreated, the future generations continued. Now we should also remember something. When we are talking of mental health, which is affecting certain mitochondria, it affects other mitochondria as well. So then we'll end up having people who are mentally unwell also having a higher than normal increase in cardiovascular problems, diabetic problems, neurological problems, digestive problems, because the mitochondria are not discriminatory. All of them say, I'm getting the illness, so let me react the way my body would allow me to react, given that I'm in that particular part of the whatever system I'm staying in. And we get into this whole thing of, oh, this means that the medication you've given is causing these problems. No. Association does not mean causation. That is the magic mantra that we should be looking at. People are terrified of medication for some odd reason. Don't be. The number of people that we have, I mean, in my psychiatric groups also across India, because I'm part of about 15, 20 of them, everybody talks about how they brought out horrible, so-called horribly psychotic mothers who have been pregnant and how they haven't stopped the medication, and the child has been born absolutely normally, and the mother has not had postpartum psychosis, etc., etc. And the number of cases which have been described where maybe a gynec says, or somebody else says, "Arey, how can you give medication when you're pregnant? You can't do that. The child will be born having 6 ears and 10 noses." And you stop the medication and the child is actually born having 10 ears and 6 noses. So we've got to be circumspect, and we've got to also realize that Dr. Google is not a doctor. The other thing that we also have to look at is when a person comes up to you and talks about, should I be doing this, should I not be doing this, should I be taking medication, should I not be taking medication, with all due respect to psychologists and counselors, I work a lot with counselors and psychologists. Rupa is one of the one I work with, and she keeps me in check all the time. Carries this danda and says, how dare you? Frightens the life out of me. I lose 5 kilos every month. I don't interfere with her work. A psychologist, by and large, if you do not agree with what the psychiatrist is doing, call up the psychiatrist separately and talk to him. Don't tell the patient, Arey, he's giving you this medication. Arey, okay, must be all right. That's not the way we do it. And over again, I come to patients. I mean, patients come to me. I come up with patients who talk to me like that. And they keep telling me this. With all due respect, you don't know enough of medicine. With all due respect, I might not know enough of psychotherapies. So it would be stupid for me to interfere with your work. If I send you the patient, I've sent it to you because I trust you. And if you are interacting with me, or the patient has come to me, she's heard about me, by and large, very few people come in on their own. There's always a referral source. So if that happens, yes, you can have a different point of view, but let's keep your nose out of my business, please. It's very important, especially at that very vulnerable time when you're pregnant. You don't want somebody saying, hi la, your child will land up having a problem. You don't want somebody saying, are you sure? You have a problem, talk to the psychiatrist concerned. Another aspect, we've got to realize also that to some extent, psychiatry and psychology works together. So of course the psychiatrist will do whatever he has to do. Now she's talked of neuromodulation. In my time, so many years ago, ECTs were rampant. ECTs are still considered to be the gold standard for psychotic ladies who, for whatever reasons, cannot be given certain medicines. They work very fast, very effectively, are very anti-suicidal. They're nothing like what is seen in movies. They're done with great care, and they're very effective. So once again, if an ECT has been suggested, let's not throw our hands up and say, you're inhuman, you're an animal. That's not true. We know what we're doing. What she will be talking about later about her methods of neuromodulation are great. Today we have electrical modulations, we have magnetic modulations, which are fairly effective. The point is, let us see, let us read effectively about what is happening. Let us not believe that something works for everything. And let us not utilize our own biases, because a lot of us are biased against medication. A lot of us might be biased against certain kinds of treatments which are used. Let not those biases come in the way of doing good for our patients. That is probably the most important magic mantra I'd like you to go back with. Nobody in the least is saying that we have a solution to all the problems that we face. But if we have the possible solution, let's give it a chance before deciding ahead of time that it's not going to work. Thank you.
Thank you. Sophia, for you to answer.
I like this audience.
Thank you. So for you to answer, for mothers who lived through PPD, I know we all understand how every approach is tailor-made, but on a general level, what has worked and what did not? Because again, following that, we're all family members, we have our sisters and sister-in-laws and mothers and everybody. What can us as people and us as professionals do to make sure that the system is more supportive in that care?
You've asked me a very tough question when you talk about lived experience. So when Preeta first told me, Sophia, can you speak of your lived experience? And it was like, no one knows about it. It's deep buried into me. And she said, would you be able to speak on this stage? I said, well, I took 2 minutes and I said, if I want my clients to open up, I think I should be able to speak about my experience too. Just bear with me. It's a little hard, but yes, I am going to try as much as I can. I read these lines somewhere, and they said, sometimes it feels so heavy when sadness has nowhere to go. So it creeps under your skin and hides beneath your bones. So I set out with just a pen and a blank white canvas to hide, hoping to find a safe space to hide all my sadness. Soon along the journey, I realized my ink had dried. So I took up to writing art with all the tears I cried. But now I don't have the tears, nor I have any ink. So I just lay on my white canvas, and all I do is bleed. And this is how tough it was. So I am a mother of 2 kids. Now my kids are grown up. My daughter's pursuing law. She's in the second year law. And my son is 16. He's preparing for law entrance. So can you imagine a girl? Yeah, thank you. Can you imagine a girl who's very aspiring, very ambitious, and just at the peak of her career, being recognized. And she's first time seeing financial independence and buying all the girly things she likes, the mobiles, the sunglasses, and the watches, and having big dreams, big aspirations. And also being recognized for it. You know, when the phone rang, I bought the first mobile back then, 3310. And I would receive calls on that, being recognized. Working 7 days a week, would you beat that? I was working even on Sundays. My aspirations were unbeatable. If I was at home, my dad would ask me, how come you're home? And then I would tell him, Dad, I have a bronchitis, I have a bad cough. Then, of course, he would prescribe me medications for that. That level of aspiration, high energy, absolutely unbeatable, unstoppable kind of an individual. And suddenly, I got married within 4 months. And that's where the journey began, right from the conception. Little did I know I would have to pay such a price. Soon along the journey, I realized I was very active. So within few months, I used to start getting comments, don't walk this fast. Why are you running around? Why you're working 7 days? Why are you like this? Why? And everything was just why. And it felt like, is pregnancy a disease? But who would stop me? Because I was unbeatable, unstoppable. I did my work. I went, I did what I wanted. I was continuing to work. And I paid a price for it. My gynac started shouting at me on the 5th month, look at you, you've not put on an ounce in the last 5 to 6 months. My family started shouting, what is going on with you? Can't you take care of your health? And everywhere it was just like, oh my God, now I'm helpless. Imagine a marathon runner, a basketball player at master's level, now suddenly required to be putting on weight, all right, and I don't know how do I do that. Well, my back then husband had an altercation with me and eventually was asked to leave my job for all 7 days. Now imagine I was at home, no financial independence, no recognition, no fame, no friends, no nothing. I'm alone at home in a nuclear family. So I'm just at home through the day. And I had nothing to do. I didn't know what do I do. Well, gradually I started reading. I started taking tuitions, but all of the tuitions and other things felt so non-stimulating, non-intellectual. I mean, it is okay, but it was not adequately stimulating for me. Though I continued, but then I was, in a few months, depression started creeping in. I realized, maybe I didn't realize, I don't know, I was saddened. I kept withdrawing a bit. My then husband asked my father, you please take her to your house. My father said, all right, come along. And I was like a lunchbox parceled to my parents' place without my consent. It just felt like, where am I in the whole process of this? And when I went there, all right, it was hard. Time went on. Towards the end, my amniotic sac burst. I don't know, I didn't realize or I didn't mention, I don't know what went on. However, I landed up at the hospital a little late. In 15 minutes, I was rushed to the OT. My parents decided, okay, you need to be in the OT. You don't have time to think. Well, I was there. Our anesthetist is leaving. And there the child was born. I don't know, the journey from being a girl to being a wife to being a mother. I was so fast. I didn't know how it happened. And when the child was born, I was okay. But that moment I realized, this is that one event where a mother is in extreme pain, emotionally so much under stress, absolutely vulnerable, maybe heading for physical injury or I don't know what damage, complete change in body, change of role, and yet responsible for a child. It felt so much. Now, that process of birth was also pretty traumatic. Somehow I came out of it, and then back again with some pain, constant pain, constant pain. I couldn't figure out. I kept going to the gynecologist. I don't know what is happening. Something is hurting. She said either she wouldn't accept or she wouldn't agree. But then I had to take a second consultation, and soon I realized I had a soft abdominal tissue infection. I landed up again in the hospital in just a month's time. I didn't have anyone. I had everyone, but I didn't have anyone. I had my then husband, my parents, my siblings, everyone, but I didn't have anyone to attend to me at the hospital. So every time the nurse came, she put an IV, and then within few hours the hand would be swollen. Then she will come, take my other wrist, tell me, now don't move. Then again it will be swollen because it's responsible for a small child. Then she would come again, put me, around the forearm. Again it's swollen, back again, and she was so upset. She said, I'm going to put it on your legs now. And that was the journey. And soon after that, hemoglobin is so low, dropped to a half, and you're panting, breathing, I don't know what you're doing, and you are still responsible for a child. There are times when I have said, oh my God, I can't carry my child. And people said, aise mat bolo, tumhara bacha hai. And it was like, I don't think I can explain that to you. But yeah, that was another first journey. So it was very traumatic for me. The second child again was not easy at all. The second child was born. We were shifting homes. In the last 1 month, I nearly lost 6 kgs because I had to shift homes. I had to go to my in-laws' place. There was an intercultural marriage my father had fixed. But now I was paying a price for even that. I couldn't adjust with the weather. I couldn't adjust with the food. The child was in the cervix, but I didn't have anyone to take me to the hospital. It took them a day or something to take me to a hospital when the child is in the cervix. When I eventually reached there, the gynecologist told me that they will have a C-section again because that's how it will be, they said. Otherwise, you take the responsibility. I said, but you promised differently while I was in Bombay. She said, I'm not going to take your responsibility. And I was back again with another child. When I was just entering my OT, then my father called. He knew I have 5 minutes to enter the OT. And he said, listen, you have a girl. If another girl is born, don't get worried. I said, no, I'm not worried. He said, if your in-laws mess, in-laws don't like it, I'll deal with it. Because I was the unstoppable. But I went into the OT, and I think both of us were hypoglycemic. I think I collapsed on the OT. They put me on oxygen. The child was taken away for 2-3 days because I think I don't know, they kept sedating me. It was hard. 3 days I had not seen my child. I was hallucinating, I was dreaming. I don't know what it was. I was envisioning. I don't know what it was. But I was howling in the OT. I was in the ICU. I was screaming, I want to see my child. By then I had in my head named him Kamal. The Kamal is that name I loved. So I kept calling Kamal Lubi, but my child was not there. They got him to me after nearly 5 days. After 5 days, when they shifted me to the ward, that's when I saw my child. I think back then I was so traumatized that I hate that place, I hate those people, I hate that gynecologist, I hate everything about South. I never want to go back again there. But that was the journey. I soon recovered in both of these cases. I remember going to my mom's place, and she said, "Why have you become like this?" I wondered, what is meant by why have you become like this? It took me 3 days to realize that she's observing psychomotor retardation. And that's when I realized, oh my God, this is depression. And then everything made sense, why I was crying in the window, why I would just not be able to sleep at night, and so on, because of so much brain fog. Soon that recognition, awareness helped me improve my health. By then, 6 months had gone. I recovered soon. I recuperated very well. And here I am back again with my craze of sunglasses, watches, and aspirations. I have never shared this. This is the first time it's coming out of my mouth.
I think it takes me a second also to say a lot of things, but not to say a lot of things. It's empowering, it's sad, it's fortunate, it's unfortunate, but all I could say is we're very happy to see you, the unstoppable, doing amazing work and probably helping a lot of us to understand what the experience could be, could not be, and to make sure that this does not happen to anybody else. So in this,
Thank you, and thank you for being so supportive. Thanks a lot. Means a lot to me.
Okay, I don't think that you can prevent it from happening. I don't think you can prevent postpartum depression. It certainly sounds like she was dealt with in a horrendously inhuman fashion. Hopefully things like that would not happen in our so-called civilized hospitals. But anyway, I think we'll all agree that we have an extremely bright and erudite young lady who's sitting on my right. Cheers.
Thank you. I'm much humbled because this is a journey I have never shared. I never opened my mouth. Some people knew I have gone through depression, but I never shared my trauma. I never shared the experiences. Not because I didn't want to, but I think I dealt very well. Oh, the unstoppable, right? So, yeah, I mean, didn't ever have the opportunity of sharing. IMHS, I think, gave me this opportunity and I just shared it. It was hard, but thank you for being so cooperative and being such a great audience. Thanks.
thank you. So we've covered a couple of things in terms of understanding the science, what happens, how it happens, what medications and other therapeutic assistance is involved. The last question is for you, Ramya, that your program is for mothers combines neuromodulation with extended therapeutic support. Could you tell us what this new technique or system is?
It's taking me a little while to recover from the last story. Yes, that was incredibly moving to such an extent that, you know, people don't have the words for the experience that they went through, are going through. First of all, when you're in the thick of things, it's very hard to understand what you're going through, because if you have that awareness, then you can sort yourself to a certain extent. But most people who are going through such an issue, they don't find the expression for it. And I mean, kudos to the work that you guys are doing, like psychologists, that you are able to draw the expression out of the person, that how, like, find words for it, find emotions for it. Like a lot of mothers that we work with, they just know the symptoms. They don't understand why. In fact, it takes a lot of courage to look into what happened that I am like this. Like, it's sometimes they would rather brush it under the carpet and move on, and then find words years later understand, because time heals, and then you see it from a third person perspective almost. Oh, this happened to me, it's not happening to me. There is a very big difference between that, and it is very emotional reaction also. So I thought that women are more expressive, and it will be easy to provide therapeutic support for them in terms of, and that will be the way forward for mothers, for people going through IVF treatment, that they will have expressions, they will find words. But it's not easy. In fact, a lot of these mothers are like, मुझे कुछ दे दो कि मैं ठीक हो जाऊँ. मतलब they don't want to dig into their past, into their emotions. They just want the here and now to be better, almost. And that's, of course, one way of looking at it. Like, if they're not ready, you cannot draw it out of them. So in the Ease for Mothers program, we do have the extended therapeutic support. But fortunately or unfortunately, like, there's very little mothers that actually opt for the therapy that we have personally seen. That's just an observation. We've catered to almost like 100+ mothers at this point. And now coming to exactly the stimulation or the neuromodulation aspect of it. Like she had mentioned, there's brain fog, there is lack of like memory, etc. This is all like our brain compensating for our heightened emotional awareness. Essentially, our brain operates in networks. Nothing happens in isolation. So if there is an upregulation of emotional sensitivity, emotional networks, then there's a simultaneous downregulation of the cognitive aspect of things. I think even in our day-to-day practice, like, or day-to-day experience as people, we notice that if we're often in our heads, like we're too analytical about things, sometimes we lose touch with our body. We lose touch with our emotions. That's because it's a balance, it's a network that, there's a balance between the emotional aspects, the cognitive aspects of the brain. Now here what happens is that there's a particular area that we stimulate called the dorsolateral prefrontal cortex, and it's like a master region of the brain, and it impacts your decision making, your stress regulation, your emotional regulation. So essentially what we are doing is that when in pregnancy, there is dampened connectivity in certain areas, we are trying to improve that connectivity in those areas so that the mothers have a fighting chance of, dealing with the stress, dealing with the sleep deprivation, dealing with everything else that's happening around them because of such heightened emotional sensitivity. Their cognitive powers of decision making, stress regulation, emotional regulation, that takes a hit. And where essentially you can look at it as improving resilience through their natural executive function and cognitive function. So that's what's happening with neuromodulation. It's a completely non-invasive methodology. For those who are worried about taking medicines, this is a very a good alternative for the mothers there. In fact, even during the IVF cycle and process, in fact, we are approaching IVF centers with this program, because essentially for the entire cycle to take place and be successful, you need to be in a stress-free situation, and you need to feel that stress-free nature. That's where a lot of these programs, IVF programs, also ask the mother to practice yoga or go to therapy, whatever makes them more comfortable. And often these cycles are very, very hard. They're successful, not successful. They're very not natural. Like, they're artificially stimulated processes. So in this process, because there are hormonal injections given, there sometimes gynecologists and the doctors there don't advise other medications to be taken along with it. Again, that's probably a result of lack of education. Dr. Kersi would answer that better than me here, but there is an active interest in not taking more medications for the mother. So that's where non-invasive, stimulation, which is not internal, not invasive to the mother, is preferred. And at that point, they do need something, right? And that's where we are hoping to provide stimulation at a much lesser cost and in a more accessible fashion, and that too at home also. Because right now, when you look at only non-invasive stimulation, magnetic stimulation, electrical stimulation, these are only available in like tertiary care centers like AIMS, NIMHANS, or in some clinics where they're very costly to assess, get. We want to make it as accessible and available as medication, and as like if you want it, you have it. Like that is what we want to achieve. And that's specifically for mothers, it's very important, through their entire process of pregnancy, birth, even the IVF cycle. That's why we've created the specific program. And along with the medical treatment of stimulation, we have given an option for therapeutic support also. But as mentioned, there, unfortunately, not a lot of women, like mothers especially, want to dig deep into their past that much, or yeah.
Thank you. I think it's very interesting to know how nothing goes inside your body and a lot is taken care of. So now we open the stage for discussion and questions. Okay. I see 3 hands. I think we take 3 questions for now.
Yes. Okay. My question is to Dr. Kersi. I wanted to ask if the person, like if mother is already on the medication for whatever, maybe a mood disorder or anything like psychiatric medication, and now a gynac is in the picture. Okay. Now I'm a counseling psychologist. We work with psychiatrists. Psychiatrists are working with us. That's happening well now, I can see to some extent. But do gynecologists and psychiatrists work together? Because because they should be aware that these medications are on.
Yeah.
And
so for what it's worth, it's much better now than what it was 25 years ago.
Okay, great.
And if any of my patients have turned pregnant, and they obviously they will tell me about it, they go to their gynacs. I didn't mean that as a joke. Nasty. They go to their gynacs, and if the gynac says something about medication, they would come back and talk to me about it. And then if the gynac has said something which doesn't make sense, I call up the gynac and I give him my recommendation, and by and large, gynacs would understand. There have been times when the gynac has decided not to follow what I have suggested. So I tell the lady, because obviously she's the one who will decide, I lay down my cards on the table and I say that the latest research points towards this. I would recommend this. You take a call as to what you have to do. I personally consider your gynac to be an orifice in the middle of the gluteus maximus, but I'm not going to tell your gynac that. Yes? But it's much better than what it was. Much, much better. Much, much, much better.
Okay, hello. First of all, before I put my question forth, I would like to congratulate Ms. Sophia that it takes a lot of courage, being a therapist or psychologist yourself, to be able to share your own personal story, knowing that your profession can be at risk because your patients are also watching you. So congratulations, you've really arrived today. And it also inspired me because being a mother of a 24-year-old daughter today, this has really humbled me that my process was absolutely normal, and I did go through normal postpartum because I had a strong family system, strong support system. So much gratitude towards them today. You gave me that. Thank you. Also, my question now is to Dr. Kersi. Since you mentioned that, psychologists, being a psychotherapist myself, and psychiatrists, we work harmoniously together to benefit the patients. And it is not that one is sanctimonious of the other. So now the question is, when you prescribe medication, would this be more of being able to, treat them or become more escapist from the situation? How do they deal that? At the same time, does it increase the risk of SUD in a chronic cases of medicine use? For example, if there is a schizophrenic patient along with a mother who's suffering through, PPT, could be PPP, which is psychosis. So in a situation like this where you need to induce or prescribe medication, is there a risk of SUD?
Very, very rarely. I've never seen it.
Okay. Any case study or something that you would like to share?
I've never read about it.
Is it?
Yeah.
No SUD at all?
No.
Well, then I would like to share a case study where recently a mother who was prescribed medication and she suffered SUD and she had become hysteric as well. In a situation like this, what would you suggest?
It's very difficult for me to talk based on what you've just told me. Obviously, I need much more details.
Because there's a high risk of substance use disorder.
And I'm just saying there isn't.
Okay.
So let's agree to disagree.
Yeah, so that is a psychiatrist talking. So the question I would like to pass.
Psychologist talking, yes.
Definitely, because this is based on a case study.
A case study does
yes.
not make it a rule.
No, it isn't. It isn't. So what is your take on this?
So my take on this is I've never seen
Okay, so I
SUD.
pass the question to Ms. Sophia. Is there a risk of SUD?
Not in my experience have I come across. If there is so, I might have to myself do a research on it, but not in my personal experience. In my clinical experience, I do, because we are dealing with a severe strata of difficulty, I do see, people with generalized anxiety disorder, including panic disorders, OCDs. That is very commonly, that is coming, trauma is there. Sometimes I have bipolar, psychosis occasionally. Sometimes, like you mentioned, substance use, eating disorders. This is what I generally get to see, but not any kind of SUD.
Oh. Thank you.
Hi. Also, thank you, Sophia, for sharing your story. That was incredibly courageous of you. My question is for the entire panel. In a world where we're fighting against mistrust and misinformation, where you have the US Health Secretary talking about how pregnant women shouldn't be taking painkillers and shouldn't be trusting their doctors, how do we as healthcare professionals, whether we're counseling, clinical, how do we advocate for scientific integrity and regain that trust that systems or that unfortunately ignorant people in power are perpetuating that ignorance?
May I answer your question?
Yes, absolutely.
Okay. Thank you firstly for the kind words. I think the journey should have been shared. I think everyone should know that, things happen and that you can still get back to life, because I'm back again with my sunglasses, watches, and aspirations. So yeah, I'm back here. So the second question of yours, we always measure the pros and cons. A lot of individuals come at my center. They tell me I have ADHD. Shall I take medication? I have depression. I'm expecting. Shall I take medication? I'm lactating. Shall I take medication? The simple answer for you is pros and cons. Measure your pros, measure your cons of taking medication, not taking medication. And you encourage the patient to decide for themselves. You are not deciding for them. If you ever have concerns about the medication bit, you only have to, as psychologists, say, I'm really sorry, that's not my forte. Could you speak to the consulting psychiatrist? And I will, if you want, I will speak to him, but you have to follow what he says. I'll speak to him that these are your concerns, but I am nowhere there. I have no say in his work. I have some trusted psychiatrists, I will refer you to them. That's it. That's your answer. You don't encourage, you don't discourage, you just help them decide. And the simple process of decision making is, don't Google. You just gather information from a professional, speak to your psychologist, speak to your psychiatrist, do the pros and cons, gather information, go and execute. That's all you do. Answer your question? Okay, thanks.
Thank you, everyone, for your lovely questions. Oh, sorry.
Yes, so we work with the mind very closely as we stimulate it, we neuromodulate it. So one thing that, across research, be it medication, therapy, neuromodulation, what we have seen is that belief moves mountains. Placebo effect is very real. So whatever the patient believes, if मतलब अगर कुछ थोपा जा रहा है उन पे, you should do this, you should not do that, then it might have a negative effect. But as long as the patient's consent and belief is worked with, then I think it could have great synergistic effects. But if you're going against the belief system of the patient, then it could also have negative effects that is unprecedented. That's why individual case studies are also very specific. That's you don't know what the person's situation is. Very importantly, like sometimes, like a lot of I don't want to take names, but like very Indic practices or homeopathy, whatever, right? Like they have very good effects also sometimes, and it is because it's aligning with the person's belief system also to a large extent. Not to say that it doesn't work or it works, but whatever the patient believes in, if either you try and work on challenging that belief in a safe environment, or you go with the belief. Okay, and it's that is where the synergistic effects will happen. Otherwise, there could be resentment if they go against their belief and trust a practitioner or whatever, that they did this to me, or I always knew that this was going to happen. We don't want that resentment to build, because that's also going to have negative effects on the body. Trust their own intuition, their body, and hopefully more and more women especially can trust their own bodies and their own intuitions more.
Okay, I'm going to wind up, I think. I've got a slightly different take on this. Given the fact that you are all intelligent people who are also in the field and who have an idea as to what is happening, I think sometimes it's necessary for us to make a stand if the person comes out with something that we know is going to be dangerous for that person. So if that person is very obviously psychotic and you know that the person needs medication, I think it's necessary for us to try to ease that person into taking the help of a psychiatrist, and not allowing the person to decide on his or her own as to whether he or she should be making that choice, because sometimes the capacity to make a choice does not exist. I'm certainly not saying that we should become patriarchal and lay down the law and become policemen, but I'm also saying that at times it's necessary for us not to be wishy-washy or on the fence and say whatever you want, which we can do if the person is not at risk either for himself or for the baby for herself or for the baby that she's just delivered. So over there is the only time when I would say that we've got to try to push towards getting the person to seek medical help. Because whether we like it or not, psychological help is all very good in postpartum psychosis, but it's medication, ECTs, neuromodulation, which makes the difference between a person staying alive and not staying alive. And I don't think that you should have any qualms about making some kind of helping decision making for the person who can't make it for herself. That's all I have to say. As a corollary to that, as a negative corollary to that, Rupa, the other day I was introduced to somebody who's a birthing psychologist. And I was just visualizing, what does she do? Go running into every delivery room saying, push, push. You want to fight against her also? You talked about podiatrists, which sounds so much nicer. What's a birthing psychologist? You must be knowing them, you're not telling us. Cheers.
All right. Please give it up for the lovely panelists. I think this one was very, very interesting. One is, firstly, thank you so much, Sophia, for trusting us with your story. It takes a lot to be vulnerable for a nobler cause of creating awareness. So thank you so much for that. I'd also like to highlight that while everybody in the panelists is so smart, so beautiful, but I have to take a moment. Sir, you're dressed so dapper. So dapper.
Please call me for all future conferences.
We'll have to.
So good for my ego. All Lucius ladies, and I'm the dapper man, yes.
Yes, we have to, at
Thank
least
you.
for the glamour element.
Thank you. Very kind.
All right, and thank you so much, Ramya, for being a grounding energy. Let's take time to please felicitate them. Please give them a huge round of applause, everyone.